Todd Warren here, founder and CEO of Dental Sleep Profits. I want to talk to you today about the difference between physician referrals and a marketing lead and how you can bridge the gap. And let me explain that gap. Right now, you probably know if you are getting physician referrals coming into your office, you know those are some of the easiest patients to convert into treatment because they're coming from a source that knows, likes, and trusts you. Therefore, that trust is ingrained in the patient because they're referred by their physician who they trust. Now, if you're running any kind of marketing with a program like Dental Sleep Profits, maybe you're using us, maybe you're using someone else, nonetheless, when you generate a lead from the community because you're targeting them through a paid advertising campaign, you often don't have that same built-in level of trust that you do from a physician referral. This patient does not know, like, or trust you. All they know is that you have a service that they think can help them. And your job, with that being the gap that you need to bridge, your job is to get that patient who inquired via your marketing campaign to know, like, and trust you. Now, how do you do that? You do that by taking a personal interest in that person's life, in their struggles, in their frustrations, and in their dreams and their hopes of what their life could be like should they move forward with your treatment.